Doctor, what will you be teaching us about today?
Today, I'm going to talk about diabetic retinopathy. It's the second leading cause of blindness in middle-aged and older adults.
That sounds scary. What exactly is diabetic retinopathy?
Diabetic retinopathy is an eye disease caused by diabetes. When high blood sugar levels persist, they can damage the blood vessels in the retina, the part of the eye that senses light. If this condition progresses, it can lead to vision loss, and in the worst cases, blindness.
Can diabetes alone cause such a serious condition?
Yes, it can. In fact, both the International Diabetes Federation, IDF, and the International Agency for the Prevention of Blindness, IAPB, emphasize the severity of this issue and stress the importance of regular eye exams.
How many people are affected by diabetic retinopathy?
Diabetic retinopathy is a very common complication among people with diabetes. Statistics show that about 30% of diabetes patients develop retinopathy. The longer someone has diabetes, the higher their risk.
How can it be detected early?
The key is to have regular eye exams once you've been diagnosed with diabetes. Early detection and proper treatment can prevent blindness.
That sounds important, but why is it more common in middle-aged and older adults?
Diabetes often develops as a result of long-term lifestyle habits, which is why it's more common in middle-aged and older people. Additionally, as we age, our blood vessels tend to weaken, so it's especially important to be cautious.
Hearing this makes me even more worried.
Don't worry. By understanding the causes and taking appropriate measures, you can prevent and treat the condition early.
What causes diabetic retinopathy?
The main cause is high blood sugar. When blood sugar levels are consistently high, the excess sugar in the blood damages the small blood vessels in the retina. The retina is a delicate part of the eye, and this damage can lead to serious problems.
How does high blood sugar affect the eyes?
Prolonged high blood sugar thickens the walls of blood vessels, reducing blood flow. This leads to a lack of oxygen and nutrients, damaging the retinal cells. Additionally, the blood vessels become fragile and prone to bleeding, and abnormal new blood vessels may start to grow.
That sounds terrifying. What exactly are vascular complications?
Vascular complications refer to damage or blockage of blood vessels. In diabetes, plaque tends to build up inside the blood vessels, obstructing blood flow. The blood vessels can also become more prone to rupture, leading to bleeding in the retina.
The thought of that happening is really concerning. What are the symptoms of diabetic retinopathy?
Common symptoms include a decrease in vision, dark spots in your field of vision, seeing floaters, and blurred vision. These symptoms can worsen as the condition progresses.
Losing vision sounds terrible, but how can it be detected early?
Regular eye exams are crucial. If you've been diagnosed with diabetes, I recommend seeing an eye doctor at least once a year. Early detection allows for timely treatment to slow the progression.
I see. What kind of tests are done?
Common tests include a fundus examination and fluorescein angiography. These tests allow us to closely examine the retina and address any abnormalities early on.
So, testing is important. But is that enough on its own?
Testing is crucial, but daily blood sugar management is equally important. Let's talk about specific prevention measures next. First and foremost, managing your blood sugar is key. Combining diet, exercise, and medication to keep your blood sugar levels in check is essential because high blood sugar puts stress on the blood vessels in your retina.
I understand that blood sugar management is important. Is there anything else I should be aware of?
Managing your blood pressure is also vital. High blood pressure puts additional strain on your blood vessels, so keeping it within the normal range is necessary. Don't forget about cholesterol management either. High cholesterol can also have a negative impact on your blood vessels.
So, blood pressure and cholesterol are important too. Anything else?
Lifestyle changes play a significant role as well. A balanced diet, regular exercise, quitting smoking, and managing stress are all crucial. By incorporating these into your daily routine, you can significantly reduce the risk of diabetic retinopathy.
There's a lot to keep in mind. I'm worried I might not be able to manage everything.
It may seem overwhelming at first, but you can tackle it step by step.
If I develop diabetic retinopathy, what treatment options are available?
The initial approach focuses on strict management of blood sugar, blood pressure, and cholesterol levels to slow the disease's progression. Regular eye exams are also essential.
So, this can stop the progression? But what if it does progress?
If the condition progresses, common treatments include laser therapy and medication. Laser therapy aims to seal off abnormal blood vessels to preserve vision. Additionally, injections of anti-VEGF drugs into the eye can help prevent the growth of abnormal blood vessels.
Laser treatment sounds scary. Are there surgical options?
Yes, surgery is an option, especially in cases of retinal detachment or significant bleeding. Vitrectomy surgery involves removing the vitreous gel from the eye to repair bleeding or retinal damage.
It's reassuring to know that treatment is available, but surgery sounds risky and I'm anxious about it.
Surgery does come with risks, but with proper treatment, there is a chance of recovering vision. The key is early detection and getting the right treatment as soon as possible.
Are there other complications associated with diabetic retinopathy?
Yes, there are several. The most common ones include diabetic macular edema, glaucoma, and cataracts.
What is diabetic macular edema?
Diabetic macular edema occurs when the macula, the central part of the retina, swells. This can lead to decreased vision and distorted sight. Treatment typically involves anti-VEGF injections or laser therapy.
That sounds scary too. What about the other conditions?
Glaucoma is a condition where increased pressure inside the eye damages the optic nerve, leading to a gradual narrowing of the visual field and potentially resulting in blindness. Treatment can involve eye drops or surgery.
The idea of losing vision is really frightening. Can you tell me about cataracts as well?
Cataracts occur when the eye's lens becomes cloudy, leading to blurred vision. While cataracts can develop with age, they tend to progress more quickly in people with diabetes. Treatment involves surgery to replace the cloudy lens with an artificial one.
I didn't realize there were so many complications. It's really worrying.
It's understandable to feel concerned, but many of these issues can be prevented with early detection and proper management. Regular collaboration with your diabetes specialist and eye doctor is essential. They can provide the latest treatments and preventative measures and develop a personalized care plan for you.
Regular follow-ups are important, then. Is there anything else I should be aware of?
It's crucial for you to take an active role in managing your health. This includes continuing with your diet and exercise regimen, monitoring your blood sugar levels daily, and managing stress.
It sounds like there's a lot I can do myself. Is there anything my family can do to help?
Absolutely. Your family can support you by helping with meal planning and encouraging regular exercise, which can boost your motivation.
Having family support makes me feel more confident. Could you please summarize what we've discussed about diabetic retinopathy?
Of course. The key points in preventing and treating diabetic retinopathy are regular eye exams, managing blood sugar and blood pressure, and maintaining a healthy lifestyle. With early detection and appropriate treatment, it's possible to prevent blindness.
I understand. What does the future look like for treatments and research?
We can expect advancements in more effective treatments and prevention strategies. For example, there's ongoing research into new drug therapies and improved laser treatments. We might also see progress in gene therapy and regenerative medicine.
It's reassuring to know that better treatments are on the horizon. That makes me feel a bit better.
Exactly. By staying informed and actively managing your health, you can effectively prevent and treat diabetic retinopathy. Let's work on this together. If you found this video helpful in understanding diabetic retinopathy, please subscribe to the channel and click the like button to stay updated with new information.
I'll be sure to check for the latest updates through your videos. For the sake of my health and my family's, I'll make sure to see a doctor if anything concerns me. Thank you so much.